So the primary benefits of using IR, interventional radiology, when treating BPH is that by its nature of how the procedure is performed, it's less risky. So it has less adverse events with respect to bleeding, with respect to sexual function or potency, for example. It also may have less risk in patients from an anesthesia standpoint. So if patients require general anesthesia or spinal anesthesia for, say, a surgical procedure for a urologic indication of BPH, in this setting, we don't necessarily require that. Some of these interventional radiology procedures, particularly with BPH, can be performed either with the patient wide awake or they can be performed under a light sedation, so the patient doesn't have as much of a surgical risk that they would otherwise have. There are many examples in which prostatic artery embolization, for example, which is performed by interventional radiology to treat BPH, has helped thousands of patients. There are a number of patients that stand out in my mind that are probably the most significant, and they're personal patients, of course, you've treated over the last 10 years. And I'd say the biggest impact that I can remember across two different types of patient conditions is one in particular, a patient who had bleeding from their prostate. So they had had multiple previous procedures for their BPH, but they had persistent bleeding and it would not stop. And they had repeated trips to the emergency room where they required a catheter. And so they had to go back to the emergency room, get a catheter, and go through this cycle over and over, which you can imagine for a patient is incredibly frustrating, and it's also scary. And so this patient then went online, researched what other options are available, and found that interventional radiology can do a procedure called PAE. And that patient then came to us, and we ended up treating him, and he had a remarkable recovery from his bleeding. And he also had a recovery from his urinary symptoms. So despite the fact that he had failed other procedures, he also had benefit from not just his bleeding, but also his BPH-related symptoms. And so that's a classic story of somebody who I can remember in my career where we've had such a great impact on not just BPH, but also the secondary effects of BPH. There's another example of a patient I can think of who also came out of surgery, and they're a friend of mine. And this is always the kind of call that physicians get, where you get a friend of yours who calls you and says, listen, my husband has this condition. They just had a routine surgery. They ended up with a catheter after their surgery, and they didn't expect to have a catheter. And they went and followed up with the urologist, and the urologist said, listen, try this medication. We'll hope to get the catheter out. If not, we can offer you a surgical therapy. Well, this friend of mine didn't want her husband to end up having this surgical therapy, and so she called me, and what I didn't realize is there's a trauma that patients go through. The last thing you're expecting when a patient goes through a surgical procedure is to not have their BPH get in the way of the recovery from, say, a knee replacement surgery or hernia surgery. And so in this particular case, we were able to treat my friend's husband, and this person had a great recovery from their knee surgery, but also became catheter independent. So their prostate gets treated, they get really right back on the road to recovery. And that's really the beauty of interventional radiology, is that when you have a minimally invasive option that delivers a great outcome, it can really be applied to so many different types of patients.